Cool. Okay. So everyone, it's my absolute pleasure to have Patricia Mechael, who happens to be our client, but she's more than that actually. She is an author. She's a public health specialist. Her work has spanned 40 countries. She's got more than 75 publications, and she's a PhD. So it's actually Dr. Patricia Mechael. And she's an absolute luminary. So there is a lot I can speak about her. That may actually take 10-15 minutes. So I will not do all of that. She's also very well known in the public health space. She's been working with a number of UN agencies as well. She is and you should talk about her book at some point, Patty. Because her books are also aimed at children. And so that will be quite interesting as well. And she's also the co-editor of M Health in Practice. And on top of all that, she's also a very strong advocate for diversity and equity. Yes, so people who are joining, request all of you to go on mute. She lives in Washington, D.C. With her son. But whenever we speak to her, she speaks to us from various locations. Like the other time we spoke, she was in Indonesia and she was in some other country. So she travels a lot as well. But yeah, thanks a lot, Patricia. Thanks for agreeing for this session. I'm sure there's a lot that our folks are going to look forward to this and also be inspired, by your stories. So thank you and welcome.
Thank you. It's my pleasure.
So Patricia, let me start off with a question, which is, I think, at least in my head, right, a lot is, why this calling? Why did you choose this path?
Sure. So growing up, I was the daughter of Egyptian immigrant parents who actually came to the United States to work with computers. So my dad had studied agriculture in Egypt, and he fell in love with computers, and he applied to immigration to any country where he could work with computers. And the United States was the first country to come up, and he came to America on his first day looking for a job in New York City in the 1960s, got a job in data processing, and had a fabulous career in computers. And then, went back to Egypt, married my mom, came over, and between me and my younger sister, my mom decided she did not want to be a stay-at-home mom, and my dad encouraged her to go and get a degree in computer programming as well. And it turns out that she's a better programmer than he is. And so he would come up with a solution, and she would fight with the problem until she came up with the most elegant solution. And so you can imagine being the daughter of, Egyptian immigrant parents growing up in the United States. I was good at math and science, and I wanted to help people. So, for them, I was going to be the family medical doctor. And so from a very young age, it was, medical school or bust. And so I pursued a degree in pre-medicine. And so I went to the Johns Hopkins University and was a pre-med student, but I was also an international relations student. So I had this kind of vision for myself of being a flying doctor in Africa. That was sort of my dream. And while I was at Johns Hopkins, I took a winter session course called Careers in International Health, and then fell in love with the field of public health. And so to me, the idea of finding interventions that could help millions of people at a time stay healthy before they actually needed to go to a doctor was very appealing and very interesting. And it was actually the World Development Report of 1993, investing in health, that really switched me on. I still have my copy of that report. It also turns out that it's the same report that got Bill Gates interested in public health. And so, which I thought was really cool. And in that report, it really, talks very systematically about the incredible gains that we have had over decades from the application of science and epidemiology to really understanding different types of health issues and then coming up with ways to prevent them. And we've seen this, over, many decades. There was the eradication of smallpox and as well as significant reductions in child mortality because of vaccinations. And so to me, this concept of being able to, find ways to impact the lives of millions of people at a time, but also, through the sort of scientific exploration and interventions was really interesting and important. And so, at 1 a.m. one day when I worked up the nerve, I called my father to tell him that I was not going to medical school and that I was going to pursue a career in public health, to which he responded, "Betty, we will talk about this in the morning." Click. So that's how I got into this wonderful field, and I've never looked back at all. I still, there's always something new and interesting to work on, to study, and to kind of think about how do we find ways to just help people live happier, healthier lives.
Nice. So I had two questions, but my first question is, what happened in the morning?
So my father gave me a long talk about how when he was in Egypt and he worked for the Ministry of Agriculture, his hands were always tied because, doing anything related to the public is very, very difficult. And doing anything with governments is very, very difficult. And then he just kept trying to convince me that I should, continue to pursue this degree in medicine. Over time, he has definitely come around full circle, and he has a newfound appreciation for public health and the importance of public health. Although early on in my career, because there was like the anthrax scares, et cetera, he thought that like my job had something to do with anthrax. And so he would explain to people that like I worked in public health and that my work was on, things like anthrax. And I've never worked on bioterrorism at all in my career. Mostly maternal and child health, mostly primary health care, never bioterrorism. I'm not sure where he got that from. I think it was just that like somebody must have said, "Oh, public health, anthrax," and he got it in his head that's what I was working on.
No, that's amazing. You know what? There is so much in common because
yes, brother.
It's not that everyone in India wanted to be an engineer. We have to put some of the blame on our parents.
Meeting on
Ujjwal, can you please go on mute? Yeah, it's not everyone in India, looking to engineer. So, I think we all have parents who have similar, interests, and obviously they're wishing well for their children. But you will actually see that a lot of folks in India as well choose one of the professional courses, as we call it, either engineering or medicine, partly because, that makes for a good professional choice, not necessarily by interest. But I'm very happy, and I think the world is happy that you found your calling, and that's happening, because of your contributions. The other question that I did have was, you mentioned about that report. So what in that report actually stood out that you wanted to make this choice?
Yeah, so in the report, it talked about a lot of the sort of like basic interventions that were having these incredible life-saving effects, and how even things like vitamin A supplementation, could be given to children to, to improve their overall nutrition and their health at, pennies, a day, or things like oral rehydration therapy for for diarrheal diseases, etc. That there were very inexpensive interventions that could be given to many children that could significantly extend their lives, and it has. I mean I have to say, over the course of the last 20 or 30 years, we've seen significant reductions in child mortality and morbidity. Unfortunately, we haven't seen the same progress for maternal health, and I think that has a lot to do with gender norms and dynamics and all sorts of cultural challenges there. But we're starting to see some decent progress there. And so, we know what needs to happen. It's just a matter of sort of, developing the systems and taking the steps to make sure that it happens in a systematic way. And it's not always easy, because you're dealing with other factors that go well beyond, your ability to improve access to health services.
Sure, sounds good. So Patricia, my next question is, it's not easy to work with governments. So what keeps you going? Has there been moments that recharges you, or gives you that motivation to continue going? If there are, could you perhaps list a few?
Sure. It's not easy to work with governments, but it's incredibly worthwhile. So it's difficult to be a government and to provide the leadership and the services to entire populations of people. So I empathize very strongly with people who do get into public service and who do serve in government positions, because my dad was right. He's like, oftentimes, when you are in government, your hands are tied. There are things that you want to do, but you are not able to necessarily do all the things that you really want to do, because you're constantly battling, with different crises or issues or just general challenges. And I have to say, in my many years of working with like ministers of health and directors of digital health and technology in different health programs in different countries, they're incredible people. Like they're like superheroes when you really think about having to be in those roles and to continue in those roles and really try to make a difference in a institution that may not be as supportive of you as they could be, or have the resources that you need to do your job well or effectively. What I will say is that most people that work in government know what the problems are, and they know what the solutions are. And there's like a challenge between getting to the solutions. And so I find a lot of my job, when I work with different people in government is almost like a therapist. So I go in, they tell me their problems. I try to help them think through their problems and then share, solutions that maybe have worked in other countries that they might consider to like address the problems, that they're having. And actually, I've had more challenges, honestly, with, leadership from like international, NGOs, et cetera, who think they know the solutions to all the problems and don't necessarily listen to what is happening in the countries, or have a really good understanding or appreciation or ability to empathize with what's happening in different countries. And I think there's a disconnect there. And I think one of the really exciting things in public health is that when I first started my career, there was a gap in public health professionals in most low and middle income countries. And now that's not the case anymore. There are plenty of people who now have, very similar training to the training that I received, in my career, who are receiving this training. There are excellent schools of public health in many low and middle income countries. And now we're starting to see this like incredible global health leadership coming from, the countries that needed people to come in from outside, 20 years ago, but now, they're the ones that are really helping to shine light on the, solutions and the ways to do a better job of preventing disease and keeping people healthy.
Awesome. So we'll sort of change track now, and we'll talk about your books. Right. So why did you choose children as sort of a broad topic? You're targeting the books at children. Of course, it can be read by people of any age, but definitely you've tried to sort of put it in that age group. So what motivated you to take that path?
Sure. So I've always wanted to write fiction, and I gave myself permission to write fiction, I want to say about 8 years ago. And I was at a sort of an inflection period in my career. We had just wound down the mHealth Alliance, where I was the executive director. And I had the good fortune of getting a fellowship to go to the Rockefeller Center in Bellagio to think about the future of digital health and to kind of document like my experiences with mobile health. And while I was there was a best-selling fiction writer, Ruta Septis, who was a young adult novelist. She was a writer of historical fiction. And then she really inspired me to, she had a very successful career as a music producer and had her own record label and had, but then she had kind of decided that she always wanted to write fiction, and she started, writing fiction. And so I took some inspiration from her, and while I was there, I wrote, the first full outline of my first novel, which was an adult novel. It was, a public health thriller about a bioterrorist threat that was.
So did your dad? I have to ask this question. You know what the question is probably.
So somehow my dad's like obsession with anthrax and planted a seed for that novel, which incidentally never published it, sitting in a drawer. Eventually it'll come out, I'll dust it off and put it out. And then I started a second project, young adult novel. And while I was working on the second project, I was at a children's writing conference and was told that there was a huge gap in smart fiction for middle grade kids, that there just wasn't a lot of really good kind of like science inspired fiction for kids. And at that time, my son was 7. And so I thought, hey, like, why not? I have, a ready-made audience at home. I can try my hand at writing middle grade fiction. And And then just as I was like, contemplating this path towards middle grade fiction, the pandemic was happening. And so we, things were starting to shut down. And I was, looking at the situation, and what was very, sad about the pandemic was that it really didn't need to go the way that it went. There was a lot that we knew, about what needed to be done, how to do it, why to do it, and it could have been handled very differently than it did, and many lives would have been saved as a result of that. I was, just joking with my son that we wouldn't be in the mess that we were in if kids were in charge. And he thought that was really funny. And he was like, yeah, if kids were in charge, then, like kids would be, healthy. We would have done what was like the right thing to do, and all of this stuff. And I started thinking about that. And I was sort of like, you're kind of like it's actually kind of true. And so kids still, they love science. They, really care about each other in a way that I think as, people have gotten older, we've become much more individualistic in our, approach to life, et cetera. And so I just thought, I would do some writing, share stuff with him, get his opinion, et cetera. But then he was like, super opinionated, and he decided, like who the characters should be, what they should do. They needed to like sneak around. There needed to be like ships. There needed to be all sorts of stuff. And so he became my writing collaborator. And so I applied a lot of the same principles that, that you all use for user-centered design to, writing this book that became, a collaboration between my son and I, he's now 10. And so we were able to have it published last October. And it follows a group of fifth graders who start to, there's a stink in the air, and it's caused by a plastic eating bacteria that is making kids and fish sick. And so they have to, learn about things like, the basics of clean water and safe water, and epidemiology and disease mapping. And they work together to form a group called the Antidotes, and they design, actually, you guys would love this, a video game to get kids all around the world to use less plastic, test their water, and map the disease. And so it's, it's a public health story. I wanted a disease that was going to impact animals and humans, because increasingly, many of the current diseases that we're dealing with are linked to the climate crisis. And I worked with one of my closest friends and colleagues. She had the desk next to me at the London School of Hygiene and Tropical Medicine. We were doing our PhDs. But she's a veterinarian and one of the world's leading experts on animal-human diseases. So I enlisted her help in mapping out a fictitious but realistic disease that that could impact both animals and humans, and then also some things that kids could do. And so there's experiments in the book and that sort of thing. And so anyway, so that's the book. I mean, during the pandemic, a lot of young people were seriously impacted and affected by the pandemic in very important ways. And so the book also deals with some of those issues as well, and sort of coming out of pandemic, but also that, as young people, it's not enough to sit around and wait for the grownups to figure out the solutions, because sometimes we do a bad job.
We do. We absolutely
and
do.
sometimes the kids actually need to take action.
No, definitely. No, definitely. I completely agree with you. I'm definitely going to go and get a copy of the book. I'm going to
Well,
see.
I can't wait to hear what you think about it. So
Absolutely. Absolutely. And I'll see what my son and daughter say about it as well. So now shifting topic, we have a lot of people on the room, and they perhaps don't know a lot about health enabled and GDHI itself. So could you perhaps spend a few minutes about GDHI, and also I think what ThoughtWorks has been working with you on?
Sure. So the Global Digital Health, soon to be called Monitor, very exciting, is an interactive web-based platform to help countries kind of measure and monitor their digital health maturity. So a lot of countries are increasingly using digital technology to improve things like access to health services, as well as quality of health services. They're also using, technology for disease surveillance, supply chain management. We're moving more and more towards wearable technology and, the ability for people to take a more active role in their own health through the use of wearables, and so. But a lot of governments are really, they're sort of building the plane and flying it at the same time, and so they're learning as they go along, and so we sort of, several years ago, we're thinking about, as we got started with Health Enabled, which came out of the mHealth Alliance and some of the unfinished business of the Alliance. We wanted something, a resource that could help raise the bar on the field and encourage a more kind of like systematic approach to investments in digital health by applying what we knew, was going to help, influence scale, sustainability, and impact of like digital health, investments and programs. And so we engaged through a very active, participatory design process with, hundreds of stakeholders, many ministries of health, to actively co-design this web-based platform, and worked with ThoughtWorks on version 1, about 5 years ago. And then in version 1, we were able to get 25 countries engaged in the platform, and but then the pandemic happened, and so we put pause on the index, because we did not want to bother countries with things while they were trying to respond to to a complex emergency. And as we were coming out of the pandemic, we had the good fortune of one of our sort of major supporters, the McGovern Foundation, to kind of take a step back, do a review and a redesign of the platform, engage with countries that had used it as part of version 1, really try to understand what they wanted to see in a version 2 of the platform. And then we have been having an amazing experience with version 2, rebuild with the ThoughtWorks team. And so some of the major differences between version 1 and version 2 are things like a year-on-year ability to track performance and investments and maturity in digital health from 1 year to the next year. We've also aligned the platform, the World Health Organization did not have a global digital health strategy when we first created the platform. And so we went through a process to make sure that it was aligned with the WHO global strategy for digital health. And we also added some indicators on things like, human rights, diversity, equity, and inclusion, knowing especially that things like the gender digital divide are growing as more and more technology is being adopted. And so people are being left behind, and equity is an important issue when engaging in the design of digital health interventions. And so those are some of the things that are kind of different in version 2, and we're really excited that we'll be launching version 2 at the World Health Assembly, with some of our partners. We also have some support from the Global Fund to pre-populate some of their countries into the global digital health platform, because they are interested in using the platform to monitor their investments in digital health over time. And I think right now we currently have about 30 countries, and we're hoping to have 60 by the time we get to the launch in May. And so so it's been a wonderful experience to work with the team, with Preeti and Snehal and and Sriram, and so it's everybody has been wonderful and very responsive, and it's been a fun process, actually. So
Thanks a lot for that, Patty. For the audience, I have probably a couple of more questions. So if you do have questions, perhaps start typing them in the chat. But so the next question I had, Patty, for you is, when we spoke yesterday as well, and now also you sort of alluded to, gender bias in health and public health. Could you elaborate a bit more?
Sure. So in health, in general, the majority of health workers are women, but the majority of health leadership are men. And so, of course, you're going to end up with gender dynamics in that sort of environment. In addition, for digital technology, there is still a digital divide that is very gender oriented. That in many low and middle income countries, women are 20% less likely to own a mobile phone or have access to a mobile phone or to use the internet. Digital literacy is very different between men and women, et cetera. And so I just finished working on a study where of a mobile health service for immunization, and the majority of the outreach workers in this particular environment are men, but they're trying to register, female caregivers into a mobile service, and the women do not want to give them their phone numbers, but they need the phone numbers to get alerts and reminders. So if you're not taking gender into account within the design, of an intervention, then you're likely to end up with some of these, unintended consequences where maybe the uptake is not as high as it could be, or the impact is not as strong as it possibly could be. And we all know that there is a significant gap in the technology space around women, and so women make up a significant smaller proportion of the technology workforce than men do, which was not always the case. I mean, it's very interesting. In the early days of computers and technology, like the original computers were women. They were female mathematicians
Yes.
that translated their, math into, automation that
Yes.
then became the computer. And so it's, I think it's really sad that we're now at a time where we've sort of like gone backwards, and we don't have really good, strong, equal representation in, the technology space. And it has an impact on, technology design to not have as many, women engaged as either product managers or, designers, et cetera. And, I didn't realize that there was this sort of like significant gap until I went to my sister. She's an, electrical engineer, computer scientist. And when I went to her graduation from, engineering school, it's like a stage at Columbia University, stage of like 220 some odd people. And you could count the number of women. It was like 18 or something like that. I remember like being like, oh my gosh. and being like very proud of her for having, stuck it out. Like she could have left the engineering school and done computer science in the School of Arts and Sciences. And she decided that no, she was gonna do the engineering, degree and go for that. And because I grew up with two parents that were computer scientists. So it never occurred to me that that there was a problem in the space and in the field. And then even in my own, career in digital health, I'm often the only female keynote, which makes me very sad and very lonely. And then a lot of times there are, like entire male panels and you're sort of like you couldn't take like the extra effort to find, the women in digital health to come and speak. And there are plenty of women in digital health. A lot of the early pioneers in mobile health were women. And in the early days, you could only find women, to talk about mobile phones and health. And, it's kind of gone through this bumpy journey, but we're now starting to see kind of like more and more, women stepping up into leadership roles and more supportive male colleagues who are, refusing to be on all male panels, which is very nice of them, and encouraging, greater, inclusion and diversity in leadership.
Well, that's great, Patty, because I've actually myself encountered situations where even some of our clients have very clearly put out saying that they don't want to be part of an all male panel, and the organizers had to actually work through that. So what you're saying is absolutely right. I've also experienced that. You would be glad to know that, on Thoughtworks, our gender diversity is, from a baseline standpoint, quite good. I think we have about 47% of our employees are women and other genders, which for a technology organization we think is quite on the higher side as it stands now. And we are not stopping there. We definitely want to see how we can continue to progress from there. And so it was also eye-opening for me when you mentioned what the ground level reality is, right? For example, we were talking about how women are not ready to share their phone numbers, and that's going to really affect the study and the program itself. And so, the interventions have to happen at that level because it has practical implications. But I'll pick up your cue on technology, and this is my last question, and then
there's one question on there.
So I'll ask this question and then we'll move to the audience, right? So on technology, right? So you mentioned about technology, but I did want to ask you maybe two questions in one. Where else do you think technology can start impacting or helping public health? And what do you think are roles that organizations such as Thoughtworks, where can we contribute in that space?
Sure. So I think there's a few things. I think one is, what we're starting to see more and more is that, any sort of success in digital health depends on overall success in digital transformation and e-government within countries. So really thinking about things like public services, et cetera, and like the movement towards digital public services as well as infrastructure, et cetera. So there's now like a growing, body of work and interest in looking at, digital transformation in general, but then also like digital health transformation that can piggyback on the infrastructural investments being made in sort of general digital transformation, because there's a lot of things that the health sector like is never going to be able to do, and can really benefit from, the innovation and the expertise from the technology sector to like help kind of like define their problems, but then come up with sort of like the best solutions. Like it's going to take a lot to, you would have to hire, thousands of techies into a health system to really digitally transform a health system. Whereas if they could just like pull in the relevant, innovations from the broader, tech sector, it's gonna speed things up a lot faster. So we're seeing that kind of like major trend across different countries. And I was recently in Indonesia, which is going through this huge like digital transformation process and a piggyback on, and, with a digital health transformation, process, and in a country of like 220 million across lots of different, islands. It's quite the epic undertaking that they that they're doing. And they're moving quite quickly, and they're actually doing a lot of learning from India. So they're doing, they had just come back from a study tour of India, where they were looking at some of the disease surveillance and the supply chain systems that, that India has implemented. And, they're looking at doing, adaptations of some of these, systems in Indonesia. So I think there's that. I think there's both the sort of the general investments in digital transformation but then also like the cross-country, learning from one place to another. So there's really great, really great opportunities with that. And then in digital health itself, there are trends, and this is something that I'm really, excited and passionate about, more towards like personal, person-centered health, where, the reality is that 99.9% of health happens outside of the health system, right? And so, we need to think more and more about how we get, healthy people to take a greater active role in their own health, and, and understanding of, basic health, concepts and ways to kind of like, increase their, health span. So, not just their lifespan, right? Because nobody wants to like live sick for a very long time, right? So like we all want to live healthy for a very long time. And so there are a lot of different ways that, that technology is increasingly being designed and used to, to help people kind of have a better understanding of what's happening with their bodies, and then ways that they can sort of like optimize, how they, approach life, so that they can, live longer, healthier lives. So I think that's, another sort of like really exciting, area to look at. And then for a company like Thoughtworks, there's the whole, responsible technology space, right? So we've started to work on book number 2, which is actually about technology and kids becoming more critical thinkers and users of technology. And I think there's an important role that companies like Thoughtworks can play in really taking, a principled, responsible approach to making sense of technology in everyday life, right? So technology is not going away, but we need to make it, safe and beneficial and practical for people to, engage and use technology without, while minimizing the harmful negative effects that technology can bring into, into people's lives. So I think there's like a lot that, that a company like Thoughtworks, which already has, at its core, like a very strong social, impact, value-based, approach to technology can bring into sort of like more of the public dialogue and conversation around becoming more, informed, consumers and users of technology.
Absolutely. I mean, we do have a responsible tech unit within Thoughtworks who try and propagate that, and we try and even discuss with our clients some of that. But I would definitely want to pick your brains offline to know a little bit more, so that we'll be able to imbibe some deeper tenets that you're talking about it. So now I think we'll probably open the thing for questions.
There's a question which says
maybe whoever has put the question can ask.
It says anonymous.
Anonymous, yeah. Then please go ahead.
So can you shed some light on how technology is being used in global digital health area to improve healthcare and access to good healthcare?
Sure. So, so increasingly we're seeing things like chatbots and health hotlines as sort of like an entry point into sort of like primary healthcare. One of the big challenges is that there's often not enough health services or health workers, and so access can be a really big challenge. And so one of the major ways that technology is being used is to like improve access to like basic health information, as well as to like health services, so that you can get to the right, healthcare worker for the thing that you need the most. It's also being used, through mobile decision support by, healthcare providers. So either through tablets or through smartphones, having algorithms that can guide a health worker through, an interaction with a patient, can both help provide better services to that patient, but also can collect useful data that can then be used for, disease surveillance or decision making later on, and can feed into, electronic health record. Similar to some of the work that Thoughtworks has done with BonMe, and et cetera. And so I think there's some really, important things there. Telemedicine, telehealth, another sort of major area. During the pandemic, there were a lot of, people who could not physically go in to have an in-person consultation with a healthcare provider. And so we're able to still receive, access to healthcare through, teleconsultation, telehealth, et cetera. And then you have everything from like remote patient monitoring. So, for those who are suffering from, chronic diseases like diabetes, the ability to monitor, sugar levels, et cetera, and try to regulate, your own health in a meaningful way is sort of increasing. And then connecting you to the health system, so that like if and when you do need to see a doctor, you can get in and see a doctor. There's also a lot happening on the prevention side. So like, I don't know, I'm a quantified self person. So I like tracking my fitness levels and my, my sleep and, those sorts of things. And so there's a lot that we know now, from having, lots of data to study these things that, by sleeping an extra hour a night, you can add, years to your life by, right now in public health, there's a phrase we throw around, sitting is the new smoking. And so, the sedentary lifestyle of, sitting, and I'm sure this is true for people at Thoughtworks, right? You are probably like glued to your, computers and your devices and, like your posture is probably not like what it could be or should be. Sriram, you need to like sit up. And also we need to like walk around more. And, so I think there's a lot of ways that technology is being used in global health to better like understand what's happening, but also to get people into the care that they need when they need it.
On a lighter note, I'm just wondering what my son and daughter would say when you said that sleeping an extra hour would add so much to your lifespan. They're going to miss school every day. Yeah. Yes, any other questions? No. Is there any question here from the audience, if you have any?
Hello, Patty. It's Nihal here. One question I would like to ask Patty, since we have been working with you on the GDHM front, and I can see that the challenges that we are facing while encouraging the health ministers of different countries to provide us the data, right, so that we can come up with more and more accurate matrices going forward. And you have been in touch with almost all the countries, health officials of all the countries. What are the typical challenges and differences that you have noticed while interacting with officials of a developed country against official of not so developed country? What are the typical challenges and differences that you have encountered while dealing with folks from different countries?
Sure. So, I think one of the major challenges is that, for a lot of countries, they're just super busy. They, and they get a million requests for assessments and things, all the time. And so they're trying to figure out, like where they should spend their time. I think once they do have the opportunity to engage with the platform, they get very excited about it. So, but there's that barrier to like the initial engagement with it, because they just have so much going on that it's like hard for them to discern, what things they can and should be, prioritizing or engaging with. One of the new things that we have done for version 2, which is helping significantly, is we are working, in addition to, to engaging directly with ministries, we are working with local digital health experts and partners to facilitate the engagement with the ministries, as well as in situations where it's like really challenging to get ministries' attention. And there are a lot of countries that are really struggling as well, with their health systems, that then to take a break and, sort of similar to like the issues that we were having with the, during the pandemic, to kind of come out and say, like, let's take a moment to really, document or measure our digital health maturity. That we are also accepting data and marking it as pending government approval. And so these are different ways that we're sort of, kind of trying to get more data into the system, so that because one of the beauties of the platform is that it does calculate a global maturity, calculation, which gives us a sense of like where are we kind of collectively as a world that is increasingly, health is increasingly global, right? The pandemic showed us that like no corner of the world was not impacted, by this like one, disease. Like in the past, it was like some countries would struggle with these things, other countries would struggle with these other things. And then we had this situation now. And then the pandemic itself also, I think, has increased people's investment and awareness of technology and digital health. And so this time around, it's actually been a lot better in terms of getting like more data, much faster, I think, than we thought we could, and which I think is going to be very exciting as we move forward.
Awesome. Any other question? Maybe we can take one last question. We are almost at the hour.
Yes, we have 1 minute more.
Yeah.
Any other questions from the audience? All right. Okay. Thank you. I mean, Patricia, this was amazing. Folks, if you want to know more, you can just Google Patricia Mechael. You're going to, get her works, her talks, and a number of videos as well. So please feel free to do that. But Patricia, I think this has been very, very insightful. My takeaway, I mean, there was a lot, but I learned one new word: health span. Right? So this is going to stick with me, and definitely I'm going to go and understand a lot more about it. And I think what you said is so true. Nobody wants to live long being sick, right? So I think we should definitely take care of ourselves when we are healthy, and then make sure that we can extend our healthy life as much as possible. But thank you so much, Patricia. I know you are very busy. You've got a rather hectic schedule. Thanks for taking this time. And thanks everyone. I know it's Friday evening. We've probably been keeping you away from your weekend, but thanks a lot for joining in, and have a wonderful weekend. Thank you.
Yeah, thank you everyone. Have a wonderful time. Bye.
Bye.